Hi, I don't normally post on here, but I feel that this is a topic that should be discussed. And that topic is about Seroquel, also known as QUEtiapine. QUEtiapine? I don't really know how to say it, but I am currently taking Seroquel. And I am also trying to wean off of Seroquel. So this video is going to talk about my experience with Seroquel and the side effects and the withdrawal side effects. And I'm not trying to discourage anybody from taking this medication because there are benefits to it if you absolutely need it. But for off-label uses, I don't find it to be as beneficial, but that's just, again, my experience. If you don't know what Seroquel is, it is an antipsychotic. It is primarily used for schizophrenia, bipolar disorder, and stuff like that in the higher realm of mental illness. I am using it for sleep, and that is an off-label use. It is not regulated by the FDA. The reason why doctors prescribe it for sleep is because it has in lower doses, like 100 and down milligrams, it has a sedative effect. Now, I started this medication about just over a month. And I know you might think that that is not a long time to be on a medication, because some of you, I know some people are on this medication or have been for years and are on a lot higher dose than me. Once you get, in the 150 to above range, it is used for more therapeutic doses. I'm not necessarily on a therapeutic dose, but regardless, anything you put into your body, any medication is going to change your brain and its chemistry. Your brain chemistry will be changed. And so, because I have been more holistic, I'm more holistic, and I don't normally take any medications. Like, I maybe would take the occasional Advil. If I even take an Advil, I don't really get into the medication stuff. And because I have never been on it or anything, it's affecting me probably more than most people who are used to putting medication in their body. Now, I started this initially in the hospital, in the emergency room. There has been a lot going on in my life that I wasn't able to cope with, and it created a very extreme case of anxiety, more extreme anxiety than I normally have. I've never really had anything like this happen, but I would be up and I wouldn't sleep for 30 plus hours because my heart was going 120 beats per minute, and I was just shaky, and I got into this negative thought process, and I could not get into this negative thought process. So I went into the emergency room where they prescribed me initially Ativan, and that was at 1 milligram, and they sent some home with me, and they told me to take it as needed, I think up to 3 times a day. I only maybe took 1 or 2 a day, and I was on that for a month, and I went from the first 2 weeks being at 1 milligram to being on 0.5 milligrams for a week, and then half of that for a week, and I haven't taken any more in over a week. So I weaned myself off of that. I do have some still, and I do have times going through this weaning process of Seroquel with the withdrawals that I just want to take one. Now let me talk about the side effects I had while I was on the higher dose of Seroquel. I was at 75 milligrams. That's the highest I got. I took that. I take it at night for sleep, and my first dose was 50 milligrams, and that was right after the hospital visit that I had. I took 50 milligrams that night, and I slept great. I slept great. And the next morning I woke up and I was completely out of it. I could barely even stand up. So throughout the day, it kind of got lesser, like that feeling of being heavily sedated got lesser. And I started towards the end of the day, when it came closer to taking another dose, I started experiencing some movements in my muscle that I wasn't doing, and a lot of twitching. And I kind of put it off because I wasn't really eating, I wasn't drinking water, and I had not been sleeping very well. So because I wasn't sleeping well and all that, eating well, and I thought maybe I was just dehydrated, or I was, it was just, I mean, I don't really know what was going on, and I was really too numb to care. I was really numb. That's what Seroquel did for me. And that night, it got closer to the time I was supposed to take my next dose, and I stood up and I went back down. I passed out and I had a seizure. I don't have any seizure history. There are some seizure disorders in my distant family, but that's a very distant family, and I think those were caused by other things. I don't really know, but I don't have any, I don't have epilepsy or anything. So they brought me back to the hospital, and the hospital did some workups. They checked for epilepsy and everything else, and everything came out normal. So they said that it was probably from not taking care of myself and my lifestyle. And they kept me for a few days. They did an MRI, they did an EEG, they did EKGs, they did an ultrasound of my heart. They did a CAT scan, a CT scan, CAT scan. They did the CT scan, and they did lots of blood work, and the MRI, everything, ultrasound, it all came back normal. So they said that this is, you know, anxiety, and that I probably had the seizure from lifestyle for how I wasn't eating. I wasn't eating anything. I lost 30 pounds. So they, I actually made the decision to go into the psychiatric unit, and I was in the psychiatric unit for 3 days. And during that time, they put me on other medications, and Prozac. They started me on Prozac, and then they upped my dose of Seroquel to 75 milligrams, and they kept me at 0.5 of Ativan and milligrams. And I left there, and I didn't know how I was feeling, if it was because of the Prozac or the mixture of all the medications that they put me on. But I stopped the Prozac after 4 days. I just stopped it. And then I felt somewhat more alert. And then I started tapering off of the Ativan. And I got off of that, tapered off of it myself, and I haven't taken one in like, what did I say, over a week? And I'm sorry if I'm repeating myself, because the Seroquel is also causing really bad memory problems for me. I don't really even remember what happened the day before. And even an hour before, it all just seems like a distant memory, and it's all blurred together. The last couple of months have just been a big blur and meshed together, like completely meshed together. And that really sucks because I have a family and I have a daughter, and I want to make memories, and it's almost like the Seroquel is causing me to not even be able to store a memory. I even will go into a room and wonder why I'm there. Even things as simple as going to the bathroom. I'll go into the bathroom and I'll be like, why am I in here? And I'll forget. I forget to eat. I've been trying to stay as hydrated as I can, but it's really hard. And I'm weaning myself off of the Seroquel this has all been with my psychiatrist's help. I do not advise you to wean yourself off of anything without talking to your doctor. It can be very, very dangerous, especially the antipsychotics and the benzos. The benzos can be really bad as well. So my psychiatrist knows that I have been going off of these medication. So I dropped from 75 milligrams to 50 milligrams of the Seroquel, and nothing really happened in that time. I was still sleeping. I was a little bit more alert during the day, but I was still completely out of it all day, and it's extended into the day. I was heavily sedated. It's such a heavily sedated feeling that I would maybe in the morning make it from my bed to the couch so I can gain some, alert, to get somewhat alertness. Yeah, I don't really know why they would put someone who's just going through a hard time with anxiety and, didn't sleep for a night or two on such a powerful drug. Like, this is not no mild drug. This is a very powerful drug. And even in small doses, it's still very, I don't even know what to say about it. It's just very, it definitely changes you and changes your, I wouldn't want to say my personality, but it's definitely dulled me down. I'm a lot more dull. I'm a lot more slow. And I mean, I'm not saying any of this is going to happen to you, but there are known side effects and common side effects that I'm fitting. Especially with the appetite. You get a really high appetite, and I've been trying not to eat everything, especially because I'm craving sweet stuff. And I mean, I always have before, but I just keep wanting to eat. I'm trying not to. But that hunger feeling, if you take a Seroquel at night and you aren't in bed, once it kicks in, you want to be eating. So I try to make sure I'm in bed before it kicks in. And, but anyway, I went from 50 milligrams down to 25 milligrams, and that's when shit hit the fan. And I mean shit hit the fan. It took about 2 doses of the 25 milligrams, and I took those at night, each night for 2 nights. And by the second day, I woke up, I was disoriented. I would close my eyes and I would see pictures in my head that I wasn't thinking of. And it was nothing scary or anything, but it was scary for me because it's why are these popping up in my head and I'm not thinking of them? And I had some auditory, I want to say hallucinations, but not really hallucinations. I would just hear, a train, or I'd hear a phone ringing, or, stuff like that. I don't know if maybe it was actually going on, or somebody had a TV on next door, or if someone's phone rang next door. I don't know. But I did have that going on, and I had another seizure. I don't know if it was between the 75 milligram and 50 milligram drop, but I know that I ended up going to the hospital, and, you know, they don't really do anything for you when you're going through a withdrawal of medication that they have given you that you aren't abusing. But if you abuse a drug, a street drug, if you take street drugs and are addicted, they have places for you to go. They don't for people who are having the same type of withdrawal from medications that they give you. And I think that's messed up, like really messed up. And I also had, I think this was the scariest symptom of all, is it was blurry. My eyes were completely blurry. If I would move my eyes or my head to look at something, there was a delay in focus. And I'm just overall a lot more tired. I'm more exhausted. I'm exhausted easier. I'm always tired, but I'm not able to sleep during the day. I haven't really tried, but I don't think it's because when you take the Seroquel, you get in a hit. Like, you get a hit of, you feel it when it kicks in and you're down. You're not getting up. Like, my boyfriend woke me up. This is the first time I've experienced this. It was a couple nights ago. He woke me up because my phone was going off, and I had already taken the Seroquel, and I've never woken up, I guess, when the Seroquel hits its top. The top, like, you know, where it's at its peak and its effectiveness. But he must have woke me up during that, because when I woke up, it felt like somebody dumped 70 beers down my throat. Like, I actually felt like somebody dumped 70 beers down my throat, and it all hit at once. And I just said, oh my gosh, you cannot wake me up after I take that pill. And he didn't know, but now he knows. But he said my phone was going off, so I grabbed it, and I'm trying to, like, turn it off or trying to, you know, do whatever I need to do with it, and I can't even see it. I can't even move my hand, not enough motor function in my hand to even do anything with it, so I just dropped it and said, I don't know, I'm sorry, I don't know, and went back to bed. I remember that for some reason, but I can't remember what I did an hour ago. I mean, I remember bits and pieces, but like I said, it's all ran together. So anyway, the 25 milligrams, I called my psychiatrist, and my psychiatrist said, okay, well, you're going to have to go back up to 37.5 because I think you dropped too soon. Or you dropped too quick from the 50. So I went back up to 37.5, and the next day I felt somewhat more normal than I have this entire month and a half thing that's been going on. I was able to get up. I was still, and whenever I took the Seroquel also, I would wake up in the morning shaking. Like, my whole body was shaking. And just this heavy weight that just really, I felt like I was not even, like, awake. I haven't felt fully awake since I started this medication. And going off of it is so scary and hard that I'm actually seeking outside help now. I went to a therapist today, and she told me that I'm going to need more than therapy. I'm going to need to be in a treatment center and detox from this. as I'm weaning and finding coping skills and be monitored going off of this because of how bad it's affecting me. So I'm going to be actually going to be assessed tomorrow at a day treatment center. It's going to be during the day. I get to come home at nights and weekends. That's nice because I do have a family and I have responsibilities as much as I can do the responsibilities. But yeah, I'm going to be going to that. Now, the only thing is when I went from 25 milligrams to 37.5 milligrams, I felt like I went a step in the wrong direction. And I know now that I didn't, because I am still dropped down from 75 milligrams. And I don't know when I'll be ready to go down to the 25 milligrams. It's a scary thought for me just because of how scary it was when I did before. Just going off this drug is scaring me because you could have psychosis. You could go into psychosis. You could have, you could die. I don't want to scare anybody, but you can die going off of a antipsychotic drug. Your brain isn't the only thing that's affected. Your organs, your body is affected. And most of your neurotransmitters are in your stomach. So when you go off of something like that, your neurotransmitters in your stomach are going to react, and I will probably end up losing another 10 pounds by not being able to eat or being with the toilet most of the time. So I'm not looking forward to that. And another thing is psychiatrists, I don't think they know how to properly wean you because they each tell you something different. Some say, oh, you can just stop taking it now. You've only been on it a month. And then some say, oh, take this for 3 days and this for 3 days and then be done. And that's what I tried to do. And I had to go back up. I didn't go back up to the 50 milligrams. I only went up to the 37.5, but that's still up. And that's still discouraging to me. That still I feel discouraged because I had to go back up. And I just want to be off of it. I never feel like myself. I have depression. Depression that I didn't have before some days. Some days I feel okay, but my mind still isn't like all there. It's hard to explain. I just feel like I'm under a constant like fog, and sometimes it feels like I'm not real. It's not fair, and I really don't trust doctors anymore after this. I know they were just trying to help and they didn't know how somebody would react, but I'm sure they've heard many people's stories on this, on the withdrawal and the side effects in general. Like, it's bad. It's really bad, to use off-label. And it might work for some people. I don't want to scare anybody. I'm not trying to scare anybody. I mean, do what you're going to do, but read up on a medication before you take it. And there's no guarantee that you will have the side effects, but there's no guarantee that you won't have the side effects. Just know that for sure, that it could be, you could have all of them, you could have none of them. It's such a gamble with psych drugs. Psych drugs are such a gamble. You never know what is going to work for you. You never know what is going to cause side effects. And because I'm more sensitive to the way I metabolize medication, everything really hits me full force. And many of the doctors think, oh, you can't have those side effects within 2 doses. It takes 6 to 8 weeks to feel any effect. Well, I do, and I know I do. I'm very sensitive to these types of things. Even, like I said, Advil. Advil still affects me somehow, too. Like, I'm the person that has all the side effects. And I don't know, you know, if my anxiety plays into a lot of it and intensifies it, but I know that I do not feel the same as I did before medication. And I know that it is affecting me hard. I know that these medications affect me hard. And I'm mad at the doctors for prescribing me this medication because I want my old self back. I want my brain to work like it used to. I'm so sick of being under this constant sedation, heaviness, feeling like things aren't real. And another thing is when you go off of these medications, it can cause insomnia. It can cause you to have insomnia, and I don't want to have that. That's the reason why they put me on it. And it's like they don't think ahead. It's like they think they want to treat your symptoms right now, which I understand, but there really has to be a doctor out there that can sit down with somebody, explain the benefits of this medication, explain the side effects, explain the withdrawal that could potentially happen, explain all the potential things and weigh it and what's going to be best for you, you know. And no, being in the emergency room and getting prescribed it, they didn't try to sit down and talk to me about what it could do. They just said, you're going to sleep. And yes, you are going to sleep on Seroquel. I don't care what your dose is. You will be out. It will be so, you'll be out. I'm just saying, you ain't getting up. You ain't getting up. A couple of times I had to get up to go to the bathroom, and just trying to go to the bathroom, I was falling into everything. I fell into the walls. It's just a bad experience and a bad time in my life, and I know I'm going to get off this drug because I hate it that much. I hate this drug. The only thing I could say it worked for is sleep. But it's going to cause a lot more problems. You can develop heart problems and diabetes. You can develop extreme weight gain. Like, some people have had really extreme weight gain where they gained over 100 pounds in just a couple of months. So that's not my case so far, knock on wood, but that's not even wood. Oh, I'm knocking on. But I think that people should be more aware of what they are putting into their bodies, because I trusted the doctors and I will never trust another doctor. I think the mind is such a big thing that people don't understand, and they're trying to help, but I don't feel that, at least for me, that medications are an option. I really don't. And maybe you feel the same way too. Or maybe you've had great experience with Seroquel and other medications. I mean, I'd like to hear if you have. I'd like to hear your experience with withdrawal and tapering. I'd love to hear anything you have to say. Just try to keep any negative comments to yourself, because, like, I'm already in a bad state, really bad state, and I just want to keep things, you know, supportive of me and supportive of each other. Like, that's what people should be doing, is supporting each other, not trying to bring them down. It's another thing. You get really thirsty on Seroquel. Like, I drink, like, so much water. That's good. It's a good thing. But they really need to create a program specifically for people going off of medication, because just like that person who did heroin, I'm having similar withdrawals. The body pain, I didn't even mention the body pain with the withdrawals, is intense. It's an intense body pain. You feel like you got ran over. So and I can't be here very well for my family. I get up and I do things around the house, but I have to sit back down. And normally I'm a person who I keep going and going and going and going, and I get things done. And that's not happening around here, so my family is starting to have to do things on their own. And they're getting upset because they've been so used to me taking care of things, because I am a stay-at-home mom, and I do pull my own weight around the house, but now I'm not really pulling my own weight anymore. But like right now, this minute, it's a better hour. Every hour will change for me, and every day will change for me, and I never know how I'm going to feel or what I'm going to think or what my body's going to feel like. It's bad. It's really bad, and I thought maybe doctors would help me, but they haven't. So just wanted to let everybody know, and maybe you can share your experience too. Yeah, sorry. I'm sorry. I don't really know what else to say. That's really all I got. So just let me know. And I hope if you are going through anything similar with any withdrawal, that you know that there is hope. There is a way. You just have to be stronger than your withdrawal. And I'm still working on that myself, so I probably shouldn't give advice unless I'm going to take the advice. But there's hope. There's always hope. Has to be, because that's all sometimes you got. And I mean, I use prayer. I've been praying a lot more, talking to Jesus, and Jesus is helping me through this as much as he can. I know he's capable. He's perfectly capable of helping me. He's capable. And I think that this experience is brought on because he wants me to help somebody else in need, and to share my experience and to help someone through theirs. I mean, I don't know for sure, but I mean, I hope I help somebody. I hope this makes somebody feel better, to know that you're not alone, at least. I'm going through it too. So, yeah, just let me know. Thanks.